Hello everyone, I am Dr. Jeenam Shah. I am a consultant pulmonologist and allergy specialist working in Mumbai, India. In this video, we are going to be discussing about asthma symptoms and diagnosis. Before we start the video, please subscribe to my YouTube channel and press the bell icon for regular updates. So we are going to be discussing symptoms. So after an exposure to the triggers which we discussed in the last video, what happens is there is wheezing that happens. Wheezing is that congestion in the windpipe that is also heard as a musical sound, which generally happens in the nighttime or early morning. There is breathlessness. People generally feel breathlessness on walking or climbing stairs, but this is all episodic. Whenever the trigger happens, you have the symptoms. Once the trigger goes away, you might become completely normal. Then there is coughing, which is predominantly dry. Then you have associated symptoms like rhinitis or skin issues in asthma. So seasonal variation we spoke about, but there is also a geographical variation. So you go to a native place, you go to some other country, city or state. In some areas you feel there is a problem. In some areas you feel very good. That is because weather, that is the environment, is different in both these occasions. There are risk factors, as you know, this particular all the symptoms happening in a children or an adult who has a strong family history of asthma, who has all the other risk factors for asthma. Then it becomes very clear that that particular child or an adult is having asthma. So how do we diagnose asthma? Asthma is a clinical diagnosis. All those symptoms happening in a person who is having risk factors generally tends to be asthmatic. To confirm the diagnosis, we do a test called a spirometry or lung function test, where you're supposed to blow inside a computer to understand the lung capacity. Apart from that, we have multiple other tests like the FeNO, that is a fractional nitric oxide test, which tells us how much inflammation is there in your body. Apart from that, we have a test called as bronchoprovocation, because what happens is sometimes the spirometry may be normal, because when you don't have those kind of asthma symptoms, the spirometry may come out to be normal. So to provoke that kind of thing, we do a bronchoprovocation test to confirm the diagnosis. Otherwise, we do allergy testing. So to figure out what kind of allergies you have, we do an allergy skin test or blood test. Skin test is more reliable to figure out what kind of allergies you have. And one important instrument is called as a peak flow meter, which is a small meter where you are supposed to blow inside very hard. That is a very good meter to help you diagnose your asthma symptoms and worsening very early. So if you have it at home and if you check it and if you see that those values have gone down, that means you are having a problem. You need to consult your pulmonologist. And very important in asthma is to rule out other causes. Not all breathlessness are because of asthma. There are other conditions like interstitial lung diseases, COPD, or any kind of cardiac condition can also cause asthma. So a pulmonologist would be in a good situation to make a confirmed diagnosis and rule out other causes of breathlessness before we label as asthma and before we start the treatment. If you have the symptoms, it is very important to diagnose it early, because if we diagnose early, we can start the treatment early and we prevent asthma from worsening later on in life. You might have seen those elderly people who are having breathlessness even while walking few steps. This is what happens if you don't control your asthma early and you let it just ignore it and the symptoms keeps on worsening. So in this video, we learned about what are the symptoms of asthma, how do we diagnose asthma, and the importance of early detection. If you like this video and if you find this informative, kindly share it with your friends, family, colleagues, and near and dear ones. If you have any questions related to asthma, kindly post it in the comment section. I'll be happy to answer those queries. Thank you.